All right. Hi, everyone. Thank you for joining us. My name is Jeff LaDolce, and I'm the Program Manager for the Tribal Opioid Response Technical Assistance Grant through the National American Indian and Alaska Native Addiction Technology Transition, or the ATTC. I'm going to be your point of contact for technical assistance questions, and my email is right there on the screen under Contact and Support. I'll also be sending follow-ups for our meetings with links to the materials and recordings, as well as requests for you to complete GPRA forms. As you probably know, GPRA forms, or GIPRA forms, are short surveys that we need to submit to continue getting our funding. So we would all really appreciate you taking the time to fill them out. We also have a web page, which I am pasting into the chat now, that has a schedule for our webinars for the rest of this month, as well as previous webinars, handouts, and recordings. We've had 3 this week to get started, but our next webinar after this will be 1 week from now on Friday. And without any delay, I'm going to pass it to Harold Tarbell and Pam Bass so they can jump right in.
Okay, thanks a lot, Jeff. And maybe, so I put up the slide on the agenda. So essentially what we're trying to do here is, again, support your work to fulfill your grants. My role is to really help to try to clarify the strategic planning process and what we've been going through working on various pieces. So today we're going to focus on environmental scanning, which includes the SWOT, or the strengths, weaknesses, opportunities, and threats analysis. And then we'll also talk about some capacity considerations and then priority setting and try to squeeze that all in today. You will see on the left the agenda, which says, how we're going to try to manage our time. And we'll go through some of the discussions there. So we are encouraging people to participate on the chat room or through the raise hands feature, which you see on the top of the screen. The little silhouette there raising your hand will allow you, if you want to ask a question or provide a comment, we'll look to do that. And we'll organize some times for that around the Q&A. If there's questions as we're going through, please add them to the chat room, where you'll see Jeff's comment there. Just noted as well. And yeah, so when we're away from our computers or doing other things or moving our papers, which I'll try to be careful about, let's mute our microphones just because it picks up the sound and we hear that. And some normal norms, so standard norms I call them, or as I like to use them. Let's engage, focus on issues, let's be respectful, let's be present. So let's, in this 90 minutes we got, let's be engaged as possible, and then take care of yourselves as well, so that in fact you can be present or and engaging in the conversation. Yeah, so this is hosted by the National Native American and Indian and Alaska Native Addictions Treatment Technical Center, I think, as maybe Kate and Jeff can correct me on the actual wording of that. So it is up in the small left-hand corner. You see, that clarified. These are the technical center staff that are available to us. So Jeff opened it up, and who's the program director, is in Alaska. So she was not sure she would be able to join. She might join just by phone when she's able. And then Kate's going to help us with our technology today. So she's going to help us feel comfortable in this Adobe Connect software that we're using. And she's been great at this. Last thing I'll say, maybe just Jeff, or is this what you had talked about earlier? Or do you want to speak briefly to this, Jeff?
Sure. Yeah, this just describes the customer satisfaction survey. That is the GIPRA form, the Government Performance and Results Act. We would really appreciate your response. So you'll be prompted to fill that out, I think, directly after the meeting.
Great. Thank you, Jeff. Pam, you want to introduce yourself?
Yeah, hi, everybody. Pam Baston with JBS International, and I've been in the field 40 years. Looking forward to spending time with you today. And I think I introduced myself on the other 2 webinars, so we'll make it brief. Okay. Harold?
Yeah, and I'm the one on the right. Former tribal chairman.
Thank you for clarifying.
former tribal chairman, independent facilitator, strategic planner for the last 20 years. I do a lot of work with Canadian First Nations and tribes. Primarily all my work is around Indigenous people and sort of ensuring that they have a voice in decisions that affect them. So we'll jump right into the strategic planning process, and maybe we'll turn it over to Pam.
Okay, I know you're probably getting sick of hearing this now, but for those of you that might be new joining us, that this is a reminder that you had a strategic planning requirement that was listed in the funding opportunity announcement on page 5. So when you pursued this funding opportunity, it came with it a requirement that you use the results of a current needs assessment if you had one available to your tribe, or that you carry out a strategic planning process to conduct needs and capacity assessments. We'll talk a little bit more about that today, to identify gaps and resources from which to build prevention, treatment, and/or community-based recovery support services, and that you need to complete a strategic plan based on the most current epidemiological data for your tribe to address the gaps in prevention, treatment, and recovery that you've identified, and that if you have existing plans, you're able to use those, or if they don't specifically address the scope of what you proposed in your application, that you would then adapt or expand on those plans accordingly. Also, to address the opioid crisis in tribal communities, you have to increase access to culturally appropriate and evidence-based treatment, including medication-assisted treatment using one of the 3 FDA-approved medications for the treatment of opioid use disorder, and reduce unmet treatment need and opioid overdose-related deaths through the provision of prevention, treatment, and/or recovery activities for opioid use disorder. And we've provided the reference for your funding opportunity announcement if you need to go back and look at those the goals that you then are responding to through your applications. And we made the point earlier that these 2 goals should be included in whatever you're doing, since they are the ones that the funder issued this set of funding around. Harold?
Okay, so just a reminder here that this is a 7-stage strategic planning process, and we've been working our way through it. So our first webinar, we did a quick overview, both in terms of the TOR and in strategic planning. The second one we did on the 6th, we did getting ready. On the 7th, we did developing vision, mission, core values, or principles. And today we're looking at a bit of a combination, assessing the environment and agreeing on priorities. So on that, we'll touch on all of the things that you see there, but on the agreeing on priorities, we'll only touch briefly sort of on the core strategic directions and the goals and objectives, because that when you look at the list of upcoming sessions, we're going to get a bit more into the details of that in the upcoming sessions itself. All right, so over to you, Kate, for our very easy poll.
Great, thanks, Harold. So I am going to open up a poll question here. It is underneath the chat. So we would love to know if you have visited the TOR resource page on the ATTC Network website yet. So please just take a minute and let us know if you've used that yet.
Yeah, so I see people are jumping in, and we're about a quarter of the way through. We're halfway through our participants.
I'll just note, if you aren't seeing that, if you have opened up the slides to be full screen, you'll have to click that full screen button again so you can see the chat and the poll, which is just beneath it.
Kate, is that the one where escape will work as well?
Yes, escape will work if you are in full screen.
Okay, so 24 of our 42 participants. Okay, there we go. It's okay. We're going to leave that on the screen, but so far we're seeing, basically the trends has been about 3/4 of the participants have gone to the website, which is great. And then there's still some votes to be counted in Broward County. Okay, that was a joke. All right. Let's move then to the environmental scanning, and that stays open. So please, we do want to encourage everybody to respond to that. Kate did note the other day, as you go back to the other websites, as well, the other technical assistance webinars, which are available through the links being provided, you can also add on to those polls where we ask you what type of strategic planning process are you using, and do you have a needs assessment already in place? So, that's in the previous two sessions. All right, in terms of environmental scanning, it's basically this whole ideal of lifting your head up, looking around and saying, what's going on around me, whether it's in the broader external community or whether it's in my organization or in the tribal community that I'm, my service community, what's going on there? And has anything changed since, we first had our initial plan? And when we look at those changes or those trends, what, if anything, does it mean for us in terms of how we are pursuing our strategic plan, or how we're going to pursue our strategies or shape them? So you see in and essentially in that first bullet point, what I was trying to say is, I want to make sure you're sort of using a few techniques and is doing that look around essentially, so that you're getting sufficient information so that you can see where your organization fits in the bigger picture of addressing this particular issue that we're focused on, and then again supports your plan, your development of the focus points in your strategic plan and the various strategies you'll do. So internal and external, we're going to show you a couple of techniques to do that. But essentially it does answer the question, when you look at the external, the community and the organization's internal environment, how is it affecting what we do and how we do it? I do want to make a point, and I have it on a later slide, but in tribal communities and indigenous communities, it's often very difficult for us to think of the community as external to the organization. And that's just one of those sort of, it's a bit of a hard political dynamic that we've got to deal with, because in a sense, we're in service of those communities. It can be a little tricky as you go through. As some of you will recall, I often say, let's not quibble too much about, whether it's internal and external. It's, that'll get clarified in the analysis and in the writing, and you can move stuff around, and the later slide says that. But I just thought I think that's critical to kind of note that tension point that we have. I just noticed Cheryl's question in about participant protection. Kate, can we clarify what that is? I just want to be, that seems important. And maybe can we...
Cheryl, if you want to your question, or you could use the raise your hand function if you wanted to ask us, and we can give you some audio rights for that.
All right, while we're looking at that, I'll keep moving. So, all right, so what does environmental scanning do? It helps you look at the various trends, identify them, organize them, and use that information in terms of, what do you got to focus on? Where do you got to direct your resources? What particular strategies may be more effective in responding to those? The challenge about this is that, when you look around, there's lots of trends out there. So if a political trend, there was a recent midterm election. The challenge is, though, is that really relevant or how much does it really have an impact in terms of your approach on this particular project? And so, yes, there's lots of big political, economic, social, demographic, technological, legal trends out there, but really, you want to sort of take it to the next level in terms of really making sure that it's relevant to you. So yeah, so I've just kind of given the acronyms there that you'll see. It's all kinds of policies, regulations, economics, technology, governance, competition, et cetera, et cetera, et cetera, that could influence you, and you're really trying to narrow it down. Lots of formats for it. Pestle, Steeple, SWOT are examples that we're going to go through in terms of external and internal strategic or environmental scanning. Pestle, political, economic, social, technological. I think that's environmental and legal. Steeple is social, technological, economic. Yeah, I'm going to forget now. But the thing that it adds is it adds ethical. So that's one of the differences of a Steeple. And there's all, when you go to look at these things over the 60 years, 50 years that they've been around, there's been all kinds of shapes and sizes to them. Even the SWOT analysis that everybody is so familiar with, it started out as a whole different set of acronyms, but essentially in terms of our current stuff, this is the kind of things we'll use. We're not going to show you all of them. We're just going to show you a few of them. So this one is a good one from the Grove graphic, and that's one of the strategic visioning models we've been using as a possible template. This is a nice slide, but essentially what it asks you to do is look outside and look at some of these trends, social, demographic, political, economic, legal, just going across the top, technological and customer community needs on the bottom. So again, just noting that challenge we often have about thinking about them as an external factor. And even in my strategic planning, I never talk about the community as external to the work of our tribal organizations. It just doesn't seem to be a good approach. It's like calling Indigenous people stakeholders. You'll be explaining yourself till the cows come home. The one thing I like about this one is the bottom right. It has the uncertainties. So, often there's things you're not sure where they go, or there's questions that you have, and in that process, you could then just anchor them there. What I like about this sort of graphic, it's standard environmental scanning, but it's kind of the whistles and bells that are there. The graphics really help. And essentially what the arrows are all trying to tell you is all of this means, you're really looking at what do those trends mean for you as your organization, and your organization, your tribe, your service outlets. Those would be represented by those buildings and those people in the middle of this particular graphic. These can be used individually. This could be just a nice drafting support to you. You can use it with your committee. You can use it with small groups. You can purchase these from the Grove graphic. You can actually print the slide out in any size you want. The Grove graphic, you can get them in flip chart size. You can get them in table size. You can actually get these in 4 feet by 6 feet, which are a massive wall size, which then you would use the whole group to help you fill that out. One of the things I thought we would ask you to do is use the chat feature to share some ideas you might have about what are some of those relevant environmental factors that could affect your work on this particular grant. And we'll ask you to add those into the chat room. And while you're doing that, I'm just going to go to the final slide on environmental scanning here. So I've noted a couple of these already. It is about which ones have an impact on you. This whole challenge of how do we treat the community. What will happen in these exercises, and I see this with groups a lot, is they'll identify a real combination, right? They won't make that distinction. And it's not really a terrible issue. It's just, something that it was as when you're drafting or when you're doing your analysis, you just need to be, aware of and giving some thought to that. So we make the point, in terms of the strategic management, it's the analysis, the thinking, the consideration that goes into it that makes this powerful. And I would note here that sometimes it's a good teaching point, right? Just whether it's a discussion point or just a clarification point, or really just helping people to sort of see those nuances between internal, external, community forces which could influence the work you're doing. And just a reminder here that you can use this technique in a variety of different ways. I'll carry on to the SWOT analysis, and just because, again, they come sort of hand in glove, so to speak. SWOT analysis is strengths, weaknesses, opportunities in threats. Essentially, what you're trying to do is you're trying to look, again, in this one, you're really giving an emphasis to the internal. So you're looking at yourself, your team, your organization. And, if you want to think of strengths, there's a good definition for it. So positive attributes, tangible and intangible, that are internal within you, your team, your project, your organization. And all of those things that enhance your ability to do what you've set out to do, and in our case, in this particular grant. And strengths are more often in your control. Weaknesses, sort of those, I guess they speak for themselves, right? Those things about ourselves, our teams, our projects, our organizations that interfere with our ability to get where we want to do and do the work that's necessary. Yeah, and it's things that we do have in our control and where we can, as a part of strategy or even just as a part of regular ongoing organizational development work that may be happening separate from this project, these things can be addressed. Looking externally, oh, and by the way, and you'll see it on the next slide, the internal stuff is really, you're looking at your current situation, you're looking in the present tense. Externally, you're looking at these trends, and in a way, it's future oriented in the sense that these could happen, these could have an impact on you, and so you're trying to, again, do that sort of, just try to keep you, thinking that way, right? So they haven't happened to you yet, but they could happen to you. Opportunities, of course, those factors outside of the organization, it really align with why you're there as an organization and what you're trying to achieve in this particular grant. And then often what happens is people then tend to think it's only opportunities that are coming from somewhere. But what you'll see in a couple of the techniques here is that as a result of this analysis, you could also then create opportunities. And so it's kind of that old saying, crisis, what is it? Chinese symbol for crisis is the same as for opportunity. So from every crisis, you can generate opportunity. Threats, again, those external factors often beyond your control that could place you in jeopardy of risk of achieving your mission, your vision, the deliverables you've laid out in your grant, your application. The classification by seriousness and probability of occurrence, that's a really informal risk analysis kind of thing. If this goes wrong, or how likely is this to go wrong? If it goes wrong, how big of an impact it's going to have? And then once that's happened, what will I do to fix that problem? The other part of this risk analysis could be earlier saying, if I see these potentially coming, what can I do to prevent them from occurring? So again, that kind of helps to shape your strategy. The strategy lessons to be taken from this. And again, much like the contingency, that's a whole, may not occur, but you want to be ready. I think the line we use in training, it's easier to change a plan you have and respond accordingly. And then sort of once that dealt with, come back and stay on track. And again, that's the underlying theory of the strategic plan. Here is this one's called a SWOT analysis, only because the Grove wants to call it a SWOT analysis and they've copyrighted it. So this is their version. And so, but essentially problems are the weaknesses. On the left, you'll see current and internal. So what are our strengths? What are our problems or weaknesses? On the right, you will see future and external. So, and again, just looking outside of the organization, what are the threats and what are the opportunities? I just want to note these blue arrows. In a sense, what those are saying is you don't want to just have a nice list. You actually want to do some analysis with that and do some cross comparison. And in fact, you can then look at sort of the interplay of these and then use that interplay to help you come up with opportunities that you can generate on your own, in addition to opportunities that maybe already be there externally. So, for example, the fact that SAMHSA provided funding for this grant, that's an opportunity. And here's just another version. This is another version of the same thing. The only difference that we've done here is in the sides, and we've also, we're going to add this to the handouts down at the bottom of the screen. We're going to give you this version, so you'll have it, because we realize it's kind of hard to read. So two things, what you see in the very hard to read print around the outside, the internal current strengths and weaknesses, those are categories or types of things that you would look at when you're thinking, what are my strengths? What are the threats or the weaknesses that we have in the organization? Same thing along the top, some categories, some things, some topic groups of what are my opportunities that I can see coming or can create, and what are some of those threats. What I try to do in the middle is that crosswalk piece is just another way of doing that. So where in the green box, where the strengths align with opportunities, internal strengths that you have now align with opportunities that are outside of the organization, potentially coming down the road, or which you could create, that's probably the best place to be in. So, green light, red light, green light, yellow light, red light. Then you really want to invest because you're in a competitive advantage. When you go to the far end, to the red, you're looking at the crosswalk of internal weaknesses with external threats, and that's probably the worst place to be in. So essentially they call that the damage control or get out of the way kind of thing. Sometimes though you can't get out of the way, so then you've got to do damage control. A good example here is your finance office or your audit has been qualified somehow. You've got some challenges. Those areas, there's more scrutiny on or new financial regulations that need to be addressed. So then what's a strategy you would use? Find somebody who has, a great reputation in financial management and contract with them to do your financial management. So it's not necessarily a complete abandonment. Sometimes you can't do that. So yeah, and so I think that's it. Yeah, so very quickly, or as quickly as we could, let's get to some questions if you have any, because yeah, we're a touch behind, but not too bad. So anybody want to ask a question or share some either, particularly I would think external trends, either in the chat box or through the raise your hand. I know Carol said you were waiting for, or Cheryl said she was waiting for a call back and had noted a question about, I have a question regarding participant protection when you have a moment. So Cheryl, this would be a good time if you're ready for that discussion. I think we just need to clarify what you mean by participant protection.
Okay, and I did give Cheryl did raise her hand earlier. Oh, but it looks like maybe she has stepped away now.
Okay, sorry, I missed that.
This is Pam. Oh, can you hear her? I think she's speaking.
Yeah, I'm working off of my cell phone, so there's just a lot of different things that I needed to do.
Yeah.
Can you hear me now?
Yeah, you're a little quiet. Can you turn your volume up a little bit?
I think it's up. Can you hear me?
Yeah.
Okay, so I just wanted to ask about the participant protection form. It's actually due today, and I had sent an email to the grant specialist, Gwendolyn, and I haven't heard back from her as of yet. And it just talked about, like, the committee reviewed the applicant organizational plans for ensuring confidentiality in the state of participation protection, and express some concerns around the inadequacy of the discussion of the following. So it does have a couple of things. It says fair selection of participants. The applicant does not provide reason for excluding certain population subgroups. So I'm just not clear on that, and I sent an email last week to a couple of folks to get back to me, and I haven't heard back from anyone, so I just need some explanation of what they're looking for.
Pam, do you have insight on that?
I'm thinking it has maybe something to do with the survey, because we are going to be doing a survey, but I'm not clear. We're definitely not clear on what they're looking for.
All right, so how do we respond, either now or following the call?
Yeah.
Someone that can follow up with me?
Harold, this
Go ahead,
is
Pam.
Pam. I was going to say that the confidentiality participant protection is required by SAMHSA. It's a safeguarding procedure that protects individuals from risks associated with participation in projects, to make sure that they're not unfairly excluded, or that their confidentiality isn't compromised, and that there's just a number of, I think there's 6 or 7 areas that they have to address in their application. And it sounds to me like her form was sent back with some questions that they would like clarifications on, and she will unfortunately have to take that up at another time. We are not able to assist with that, Cheryl. That would need to go back to your project officer.
Okay. I mean, I'm just a little concerned because the due date is today, and I've reached out, so I'll just follow up again with her. So I just wanted to make note of that.
Yeah, and you, if you're sending it by way of email, you have documentation that you did attempt to meet the deadline. So I would just encourage you to make sure you have something in writing, that it's not all verbal. You're not just trying to reach somebody by phone, but that you sent an email that indicates that you're attempting to get this squared away.
Yeah, I did, and I also spoke with the director. I sent an email to Martha Beadle as well, and she has been corresponding back and forth, but she's not clear on that. But I guess Gwendolyn, my project director, is out of the office till after the weekend, and I just got that this morning. So I'll just wait for her to get back to me. Thank you.
Thanks, Cheryl.
Sure.
By the way, I do also want to note that we've had about 29 of our 48 participants have responded to the poll at the bottom right of the screen, which talks about, have you visited the TOR resource page, which is being provided by the Technical Center. So about 50%, 6% of you. I just want to encourage the rest of you to be brave and use the click the button. I think nothing will happen. Nothing bad will happen. Yeah, I can hear that as well. Sorry about that. Occasionally that happens with my headset, so I'll try to move my mic a little bit, see if that helps. The other thing that often happens with an echo is when the sound comes through your speakers, your microphone might pick it up, and so do we get that as well. Okay, so Cheryl, you just disconnected. Hopefully you'll come back. As I think we're going to look to keep moving forward, I do want to encourage people to use the chat or the raise hands features whenever they need it throughout the organization, throughout the webinar. And sort of the question that we've kind of put to you is, to the degree that you can think of some of those trends that you might be having that might affect your ability to pursue your project. Whether, I guess, to the degree you're willing to share, and whether it's internal or external. I think external is a little easier to share. We just want to encourage you to add that to the chat room, or if you want to speak to it, to use the raise your hands function at the top of the screen.
And Harold, this is Pam. Can I just prompt a little bit here? So, for example, some of the external threats that are happening in other places are policies that are limiting arbitrarily a person's ability to enroll in medication-assisted treatment for more than a certain length of time. So some regulations are trying to cap how much time a person can be on medication-assisted treatment, like limiting it, let's say, to 6 months, when a person might need more than that. and typically will. And so that's a threat you might not be able to control if you are, under that regulatory body. The examples of opportunities, there's all kinds of cool things happening coming down the pike with things that will increase access to care, including opportunities for more telehealth and telebehavioral health. And so these are just a couple. I just want to throw a couple examples out there. Perhaps expansions of Medicaid that might pick up more of the medication. So when this grant award is over and you might have a need for continued access to, financially assisted medications, if the area in which you are operating has access to an expanded Medicaid formulary or insurance policies that are increasingly picking up medication, that again might be another strength. So I just wanted to throw a few out there just to get the conversation started, or to have you be thinking about these kinds of things and to see what's happening in your area.
Yeah, excellent, Pam. Yeah, and I think that's really the kind of helpful information you need. It did remind me of one other thing too. So sometimes what will happen is people, when you look at it, people will have put something in the wrong category. So what often happens in the external, they're thinking of it, when they think external political, they'll often think only of their internal political. So again, it's not necessary to sort of have a bit long argument about that. It's really just to be aware of that sort of as you're going forward. And even in the material that we had looked at, under just above the yellow slide here, the yellow part of this slide, which is the possible threats category, about the fourth button up, which is fourth item up, probably impossible to read, but it's loss of key staff. So from my perspective, that is actually an internal weakness issue. So that's what's going to happen, unless they're referring to let's say your project officer or some of the SAMHSA folks, or something like that. That could be an issue for you in terms of building up. Internally, though, if you're thinking of your own staff, that would be an internal weakness. And essentially what that would kind of, when you think about that, that would boil down to things like low morale, interpersonal dynamics, lack of competitive salary, those kind of things. And when you look at the categories which you see listed, for example, on the weaknesses side of this scale, those are some of the, the competitive, your competitiveness, that's what's listed there. So just another sense of, use these tools to your own advantage, so to speak. If there's no more questions, maybe we'll move on. And perhaps, Pam, just I'll get you to pick up on the capacity building, and I'll just weigh in, just to, as I like to say, so I don't get enamored of my own voice.
Well, I can certainly do the capacity definition. So when we talk about capacity building, there's a number of definitions that are out there. This one happens to be one of my favorite, which refers to strengthening the knowledge, abilities, and skills. We also call these KSAs of individuals, which could be your own workforce or the broader workforce with your partners and collaborators, and also improving organizational structures and processes to more efficiently meet the needs of the community in a sustainable way. And I like this definition because it does include sustainability, which is something, we're all very fortunate that we have these funds from SAMHSA, but they are time limited to this 2-year period, and we have to start thinking right away about, well, how will we make sure that all these efforts that we're collectively making and that these investments that SAMHSA made can continue beyond the end of the grant award. And so in this instance, just to give a few examples with capacity building, this is a very new area for some tribes working in the area of opioid prevention, medication-assisted treatment, and such, and the associated recovery supports. We've heard back from a number of tribes, especially out west, that they're more familiar with dealing with individuals who have problems with methamphetamine, but opioids, kind of coming on the horizon, and maybe they're not as experienced. And so there's a learning curve there to help individuals that are working with folks with an opioid use disorder to help not only the staff, but any of the partners with whom they work really get a handle on what is it going to take to be effective in this area. And so there's a lot of knowledge that has to be conveyed through training and education about, what is an opioid use disorder, how does it differ from other substance use disorders, what kinds of skills does a person need to have to be able to work effectively with someone with a substance use disorder, and all of that, again, happening both within their own internal workforce and the collaborators. The opioid prevention and treatment work is rarely done in a vacuum. It really takes everyone rolling up their sleeves and working together. And sometimes you can work, very hard. I'll just give a couple examples. Where, I've worked with the treatment providers that have just really come up to speed and doing a great job with making sure that individuals have access to effective medication-assisted treatment, only to find out that when the person leaves treatment and they go to get in some recovery support, recovery residential housing, they encounter barriers in some instances where the recovery housing folks say, well, you're welcome to come, but you can't come if you're on medication. And we try to educate them that, medication for opioid use disorder is no different than somebody being on medication for depression or anxiety. You would never ask someone who's finally stable on their, mental health medications to, pull the rug out from under them and go alone without such life-sustaining, stabilizing medication. So there's a huge effort here that has to be undertaken in capacity building, particularly for folks that have not had a lot of experience in this area. So, and I recognize some of you on the phone have been doing this for years. Some of you are new at it, but that's what we mean by capacity building, and also to identify resources and build readiness to address substance use and misuse. And so you will find that through this project you'll have access to lots of resources by being a SAMHSA grantee. One of those resources is technical assistance, but also that SAMHSA provides a wealth of information on their websites with opioid toolkits and all kinds of medication-assisted treatment guidance, and so we'll make sure that you have access to that if you don't already know how to get there. Harold?
Okay. Thanks, Pam. Appreciate that. So,
sorry, Harold. Yeah, there you go.
Got it. Yeah. So, lots of places where capacity can be looked at from. We're going to look at it from two ways. So, what does it mean from a strategic planning level? And then we're going to have Pam talk a little bit about sort of what's it mean more practically in terms of one of the requirements, which is around workforce development in this particular project and the medically assisted treatment, I believe, in this one. What you see here on this slide in terms of this first one is that really when you're looking at capacity and doing that assessment, these are a number of the areas where it's often needed. So human resources, financial management, facilities and equipment, external communications, information technology, planning and evaluation. One that often gets missed, and it's sort of one of these chronic areas that we're always struggling with, is role clarification. And so in a way, that is a capacity, being clear about your role than the roles of others relative to this particular project and relative to the organization is pretty critical. A lot of times we sort of get caught up in sort of the detailed terms of reference and that kind of stuff. But as long as, again, we don't lose in the language of the drafting that role clarification, I think that's pretty critical. This is an area where, so when you're looking at capacity considerations or capacity assessments, this is kind of when you get into that needs assessment and gaps analysis. And it's from a strategic planning point of view, it's a little bit different than what they talk about in terms of the FOA itself when it talks to needs assessment. They're talking generally in terms of needs and gaps relative to treatment, prevention, and recovery around opioids and substance abuse. Here, again, we're just talking, in some respects, you think of it as your ability to fulfill the program, the project. So you assess the needs. You need to ask the question often, are the right employees in the right jobs and have the right knowledge, skills, and abilities? And, to the degree that they're not, or, there's some workforce development needed, that's the gap that has been identified. Gaps can be looked at in a kind of a number of different ways. In a way, in strategic planning, when you look at your environmental scan, this is our current situation that we're in, and then you look at your vision. This is where we want to be, the work that you need to do in your mission, and then so your core strategies and your goals and objectives. That's in fact the work you're going to do to close that, get that particular gap between where you are now, so where you're planning to go as a result of the project itself. Yeah, so and then of course there's just decisions to be made about filling some of these gaps because again there's timing, dollars, organizational change, structure, infrastructure needed. There's a series of issues that need to be considered from a management point of view. Here's getting into a little bit more detail in terms of some of these capacity gap areas that are often identified. So from a strategic planning perspective, we didn't really analyze our environment very well. We didn't get good data, so that's not really helping us. It's often we get data, as mentioned, not directly related to us or that, will have a direct impact on us. It's great, it's not like it's not happening in the environment, but it's again, not as impactful or directly related to the project we're working on. The second one is really, in a way, it's not valuing, not appreciating, not understanding the strategic planning process and how it links to your organizational management. So, that's a dynamic. And then recruiting, of course, is the workforce development stuff. So some of the reasons you don't have, you may not have the right people in the right place with the right skills is because of that recruitment. I often have a joke with with the HR director at my own tribe in terms of what's our number today in terms of full-time, temporary, transitional, part-time employees, and every day he has a different number. The other ones there, so again, just making sure the tools and the technology that you use are, appropriate and people are using them. So we have lots of technology that we don't actually capitalize on. These last four are, let's say, some competency areas which, are often identified. Project management, the whole ideal of being able to put a project out, develop the budget to it, have done the math and the thinking clearly enough so that in fact there's minimal changes as you go through so that you can do this project on time and within the budget. And then, if you ever go, it's a whole field of study. There's certifications available in it. Performance measurement is another key piece. We often we focus on the things that we're doing, the inputs and the outputs, and the products that we produce, as opposed to the outcomes, the impact we're creating. So again, some area that we need some work done on. Communications was mentioned earlier. Change management, just being able to ride that current because it's a rough transition to go from where you are to that visionary place you want to be. And as a tribal chairman, one of the first lessons I ever learned was change is very popular when it's being promised or asked for. It is incredibly unpopular when it's being delivered. And there is a whole organizational development scope of work or, a theoretical body of knowledge plus some practical strategies about how to navigate change and some of the key strategies you can use. Take a quick look at that. That actually can help you shape strategies in your strategic plan and in fact how you would then implement your plans given the state of the organization. And Pam's going to talk a little bit about sort of workforce development in a second. We had done in an earlier discussion, we mentioned briefly some capacity considerations. The Hewlett Foundation had done an assessment of a wide variety of capacity assessment tools and capacity building tools. And essentially the lessons there were tools and processes are great. They do help you to have that conversation. They do unravel the complexity and help you to have a better understanding about what needs to be addressed. But they're only a part of the process. You got to make sure that the tool fits your context. You got to make sure that you're adapting the tool as necessary. So, just to really focus on that, because in that way, and then in the utilization of the tool, there's a couple of key things that need to be noted, and that is bringing in skilled facilitation, somebody who really knows that tool well, and many of you are bringing in people who know strategic planning well. So again, that's very helpful in making it relevant to you. I think the other part is this whole idea of just utilizing the tool, participating in the process as So participating in a strategic planning process, that's just as valuable as the results you get, because it does sort of help you to, again, unravel complexity, be better aligned and coordinated, and really sort of have the engine firing on all cylinders. And then the last bullet point there is, a lot of times when we're talking about these capacity areas, our funders as well are dealing with the same struggles. They're very good at being funding officers, but in the sense of some of these other dynamics, so in the treatment profession or the prevention work or in the aftercare work, they may have some of those same capacity challenges that we note there as well. Pam, I'll turn back to you in terms of some of the specifics.
Okay, so one of the things that I mentioned we want to do is the strengthening of your workforce capacity. And given that the major goal of this initiative is to expand access to medication-assisted treatment, one of the challenges that you may have, and particularly if you're in a rural area, is a lack of medication-assisted treatment providers. So in other words, you may have lots of doctors and, nurse practitioners and PAs, physician's assistants in your area, but they might not want to be a provider of medication-assisted treatment based on some of the stigmas and discrimination that's happening with this population. And also some of that is just a misunderstanding, where once they have greater understanding of this population and the needs, then they're more willing to be a prescriber of, let's say, buprenorphine, one of the buprenorphine products, or Vivitrol or something. So basically, that can be a challenge. Or you may have that there's a wavering process that can happen where physicians, nurse practitioners, and physician assistants are able to take a training. I think you can even complete it in like a weekend. It's not a huge cumbersome training, but that allows them to be wavered so that they can also prescribe this medication. And so you might even have access to such practitioners, but maybe, and that's a good thing, but maybe those particular practitioners don't have a lot of experience working with American Indian or Alaska Native populations, and so they may lack the cultural competency that they need to be effective with that population. So, for example, when we go in April to, again, we're still waiting for the date for our meeting, our goal is to try to bring to that meeting, the technical assistance meeting, physicians that are Native American who have been prescribers of medication-assisted treatment so that they can provide training to and just an orientation to some of the grantees that might still be struggling in this area. Also, you may have an insufficient number and access to behavioral health specialists. So we don't ever just provide medication for an opioid use disorder. We provide that in conjunction with behavioral health counseling and other traditional practices. And so maybe that's an area of the workforce that you need to build additional capacity. And so because these things go hand in hand. And then also, I think I already mentioned that sometimes there's a reluctance to treat persons with opioid use disorder. And so even if they have the right skill set, if there are fears or a lack of knowledge or understanding or compassion for this particular population, then that's a workforce capacity building area. Then also training and education is critical, and I think you know that in your funding opportunity announcement, that was one of the required areas that you provide training and education, and that's so critical. And lives are at stake here. This is a life-threatening disease, a substance use disorder, and nothing is more dangerous than the overdose from opioids. It happens much more than the other substances that we're used to. And so there's an urgency here to make sure everybody understands what is at stake. And we can't make policies to constrain access or to put arbitrary limits on how long someone can be on a medication, or to tell for judges or judicial folks to tell clients that are in the child welfare system, you can't get your kids back till you get off of your medication, when they might have achieved stability for the first time in their lives or in many years and functioning in a very stable, effective manner. So all of that, there is a lot of training and education that is available at no cost, and we also can help connect you to such opportunities through the ATTC. Related to the training for the prescribers, the National American Indian Alaska Native ATTC does have both cultural competency training and also the waiver training, and so we will connect you to that training as needed through our resource page. Okay. Stigma, really it's discrimination, we should call it what it is, and that plays a very important role in the attitudes and perceptions, especially around opioid use disorder. And stigma in the community can discourage individuals from seeking treatment and providers from offering it. And this is particularly happening with pregnant women who are so terrified to come forward and let their healthcare practitioners know that they are using opioids, and so they often don't seek prenatal care. They're afraid their child will be taken away from them, and they may not be aware that there are protocols that can help them get off of their street drugs and onto a stable medication that they can safely take during pregnancy, Subutex, and there's that would help stabilize them and their baby, their neonate. And so this is something that the stigma can really cause people to go underground and to not come forward for the care that could and should be available. Local leaders, including providers, should be advocates for individuals with OUD to improve awareness and understanding that addiction is a chronic, recurring, but treatable disease. Something that's very important here to let people know is that a lot of times they'll get, because opioid use disorder is so intense, and the person who is dependent on opioids, if they try to get off opioids, they get very sick. You might hear the term dope sick, but they get very, very sick, and so they're very invested in avoiding this sickness, and they'll do just about anything to avoid that. They're not getting high anymore. They're just trying to feel normal. And so one of the things that happens is when they go in for care, particularly if it's without medication to assist their treatment, they often relapse, and it's really not relapsing if it happens right away. It's really that they're recurring. Their use is recurring, because to relapse, you would really have to have the benefit of a full episode of treatment to its, completion. And so early kinds of return to use is not a failure or a relapse, and so it's something that we know and expect to see and try to continue to work with and through. But there's just a long process of educating our leaders and our partners about this is a treatable condition, but that it does take time. I just want to remind folks that Dr. Eleanor McCants-Katz, who is the Assistant Secretary for Mental Health and Substance Use, she describes medication-assisted treatment as the accepted life-saving standard of care for opioid use disorder. And so this is an effective message that needs to be communicated to the individuals that work with us and our community partners, so that they understand that we are talking here about a life-saving standard of care, and that we have a lot of, a lot is at stake here if we don't help folks access such care. So although we have, we talked about capacity building around workforce. I want to take a minute to talk about organizational structures and processes. That was part of that capacity definition that I went through a little earlier. And so we don't have time to go through a lot here, but just picked a few important points. One is financial. So although medication-assisted treatment services are covered by many public and private payers, This is a constant changing area, and the formularies are changing, and so you have to be vigilant about understanding what these practices, these financial reimbursement practices are, and to figure things out like, for example, if you were to be serving, and I'm making this up just as an example, a population of, let's say you are prioritizing a subpopulation of people who are victims of intimate partner violence, and so and who have an opioid use disorder. Such an individual may need the injectable version of medication for opioid use disorder because they only have to get that once a month versus having to take something every day that their partner could take away from them, keep them from their life-saving medication, hide it, take it, sell it. So if you were serving that population, let's say in large numbers, and you realize that the only medication you were able to get reimbursement for was not injectable but was an oral medication, then that would be a barrier that you would try to work through and find out how you could offer other options of medication that are effective for that population. So, or if you found out that that the insurance or your Medicaid plan was limiting the number of months of reimbursement, and you knew that your clients might not be able to continue once your grant award is over if those policies aren't adjusted. So it requires a lot of advocacy and leadership to look at those financial barriers. Also, another organizational structure is recovery supports. These are absolutely critical to obtain and sustain recovery, and I'm talking here about recovery coaches, peer support groups, and recovery residences. These are just some examples of the kinds of recovery support that can help somebody achieve a healthy lifestyle who has previously had an opioid use disorder. And so knowing that there's some of these groups that are reluctant to allow people that are on these medications to receive the recovery support that they need might mean that you have to help develop, either educate some of the recovery supports that you have access to, or create new ones that are open to individuals who are receiving medication for their opioid use disorder. Another process is technology. Some communities, including rural areas with limited facility infrastructure, are increasingly having success using virtual support groups and web-based or telehealth platforms to ensure that the individuals receive treatment and recovery support. And there are some changes in legislation. I think it's called the Support for Patients and Communities Act or something like that, that is starting to look at making some improvements in access through technology and other things to help with this issue of getting people with opioid use disorders connected to evidence-based treatment. Other access barriers, let's see, we talked about the cost, limitations on time and office space, cumbersome regulations. Remember that in your funding opportunity announcement on page 8, one of the requirements is to provide assistance to patients with treatment costs and develop other strategies to eliminate or reduce treatment costs for under and uninsured patients. So these issues around looking at your barriers in your area and finding solutions that will help improve the access. So we'll stop here and see if folks have any questions.
Yeah, Pam, Lakota Pochetley has put a question in the chat room. So could you provide an example of one objective and activity-based off the strategic activities plan template to show how we should be phrasing items? And then how do we translate the information and data we're gathering and analyzing using these processes discussed and incorporating them into our objectives and activities? Just on that,
That is an excellent question, and we will actually have a couple of webinars on that specifically. But when we get to the priority setting, I can give you an example in that part of this webinar, if that's all right. That's a very good question, and we do intend to dedicate some more substantial time to that in our next webinar. Let's see, do we have, oh, okay, you're welcome.
Yeah, that's November 16th. I also remind everybody that in the FOA, I think it's page 46, SAMHSA provided some language to help you shape goals and objectives, giving you some sense of what they were looking for. So that's available to you as well. Are there other questions? Too bad. We're not doing too bad on time, Pam.
Okay. So you want to move forward?
Sure. Okay, just making sure nobody raised their hand.
No, we haven't had any hands raised, but I'll keep my eye open for that. Thank you.
Okay, appreciate that. I did want to note that we've had 33 of the 42 of you respond to the poll question, so appreciate that. So again, staying in that same area, 82% participants have gone to the site for the ETC sites. I see Elaine is typing there.
Oh, yes, Elaine asked if we can repeat the question since the callers cannot be heard, since some people are calling in by phone. The question that was asked was, would we be able to provide an example of an objective and activity based on the strategic activities planning template, and how they could phrase items, and how they would take the data, how you would take the data that you're gathering as part of your data collection efforts and make sense of all of that. And I'll just go ahead now, just off the top of my head, and give a quick example. So, for example, let's say your data showed that within your, let's say you had a large tribal jurisdiction, and within that you used data to determine a particular community that was having a lot of overdoses, of opioid overdoses, and you knew that the use is, the overdose is obviously a proxy measure for use. They overdose from that opioid. So you decide, this is the area, this particular neighborhood or community that we are going to focus on for outreach to get people into medication-assisted treatment and the associated, therapeutic and cultural supports. So you would use your data perhaps to sort of narrow down the group or subgroup that you would then want to provide or increase access to medication-assisted treatment. So that would be, your goal would be to increase access to medication-assisted treatment and the associated supports. And it would be for population XYZ or neighborhood or, whatever your subset. Or maybe you're doing this tribe-wide. But at any rate, then if your goal is to increase that access, and we know that's one of the SAMHSA goals that you're, going to be addressing, then the question is, well, what are the next things that have to happen for you to increase access? Well, how are you going to do that? Do you need to look at some kind of outreach? And so one of your objectives might be to to develop an outreach model, or to expand a current outreach model. It's whatever you said in your application. But I'm just giving you an example. So then you also, in order to expand access to medication-assisted treatment, you might find out that there's not enough prescribers to meet the demand if you were to get these people in. Well, then what kind of, waiver training might you need to connect practitioners to that would enable them to be allowed to prescribe the opioid medications? And so that might be an objective. And so, that's the goal would be to expand access, and your data would tell you to whom you are expanding access. And then your objectives might be, what are the concrete steps? By what date will you, be able to get that training accomplished, or get those outreach workers, in the field? And even using those objectives, there's a number. You don't just state, I'm going to have outreach, or I'm going to do the waiver training. There's then a lot of strategies that come, the activities that have to happen to make those objectives occur. So you might have to, reach out and find out where the waiver training is, meet with the physicians and, talk with them about your project and make sure they can have access to the training, figure out who your outreach workers are going to be, or how they're going to conduct their outreach and where they're going to do it and how they conduct themselves when they go. And so all of that detail is what would be some of your strategies. So we'll cover this in more detail with actual slides that you can follow along. I hope that was helpful, but I was trying to take you from the goals down to the objectives and then to the strategy level.
Thanks for that.
Also, we're being asked to give the link to the TOR resource page, and we did have that at the top of the chat box, but I don't know, Kate, if you or Jeff can just put that in so that it's lower down on the list here.
Yeah, bottom line, there's a little
Thank you, Jeff.
bar on the right of the chat room that should slide you back up and forth, just so participants who know they can go back and revisit some of the comments, especially if they go back and look at the other webinars, they can scroll through them all. But yeah, for ease of use, it's put there. I would just say on this question of rephrasing these things. And how do we connect it to the template? We're going to give a lot more detail on that on November 16th. But go back to also look at slide 10. By the way, on the bottom of your screen, you'll see the files. So the handouts that is listed there, those are these slides. So you can download those and have easy access to them. And I'll note also the Swot Analysis chart there. The green light, yellow light, red light graphic is also available there. But slide 10, one of the things it talks about is what does a strategic plan look like, and it gives a bit of an outline. And then I think in our October 16th, our first strategic planning webinar, we give a little bit more detail. I would say one distinction to make in terms of wording from a strategic planning point of view, when you get to goals and objectives, it's really about trying to get to the question of why you're doing something as opposed to what you're doing. In the TOR or in the FOA and in your applications, in many ways you laid out some language, but you also spoke to the what you're going to do, and maybe I'll just use that as a bit of a segue as well to the priorities, because in a sense, when you look at the FOA, that is SAMHSA stating its priorities. Its priorities are those goals that they've laid out in the FOR about increasing access to medically assisted treatment, and then using prevention and recovery and those treatment, prevention, and recovery to reduce opioid-related health issues and addictions and overdoses and deaths. So that's them stating their priorities, and then when you look at the requirements, which we have attached at the back of this proposal, this webinar. Again, those are then the sense of stating its priorities for what it wants to do. So priorities is one of those words, like goals and objectives, for example, that can mean many different things to many different people, depending on when, where you are in the process of looking at it. Yeah, and so I see Kim's comment, the due date, which we're all very aware of in terms of the end of the month, and so webinar slides available now, so it help you meet these deadlines. So these first three webinars, so the October 16th, November 7th, and November 9th are available, or maybe it's 4 already, November 6th as well. Those are available when you go to the link, which you'll see in these later slides, and when you go to the resource page, there's a link to the webinars. So those are all there, and all those tools are available. As Kate's pointed out a couple of times, if you go back into the archives of these webinars, you can access all the handouts and the resources provided, and you can also review the chat commentary, because there were some very helpful things in there as well. and then we're trying to be as supportive as possible.
And Harold, I'm willing to take a shot, take that template and provide like an example of wording, like just so folks can see what a sample would look like, if that's helpful. I could just fill out one. But I would also refer you to the Tribal Health Agenda. I think we have that on the website. If not, we will add it. Because that is an incredible document that was a lot of folks had, I want to say over a year worth of effort into, perhaps more, that it is really explores, it's not opioid specific, but it would give you some really good examples of how to frame the issues that you identified in your applications. It has has a whole chapter on workforce, and then workforce goals, and a whole chapter on treatment and prevention, and it's very well done. And so I think that sometimes, you know what to do because you've written your application, you know what you're signing up for, but it's just getting started, like finding some of the words to get rolling. And so I think we could do two things for you right away. To put on the TOR resource page, if you think that would help.
Yeah, and people are responding. Yes, so a couple of responses that would be perfect.
Yeah.
The other thing is, I think
okay.
we've been doing some searching for opioid-related strategies. We found a few, not all, not necessarily from the United States. And if we haven't, if we haven't put them up there, or if there's no restriction on that, we might want to just think about starting to share those as well. This is a worldwide issue. People are dealing with the same thing. There may be some lessons learned from those other countries as well. I do want to keep us moving. We're 12:17, so we've got 13 minutes left or so to finish up. And just to finish out on the priority setting agenda. So as noted, priorities play out in a lot of different ways. The bottom line is, when you're talking about priorities, it's wherever you are in the process, it's about making choices. Where you're going to focus, what your strategy going to be, where you're going to put your time and money. We've already done it a couple of times if you think about the strategic planning process. So in the getting ready stage, there's a part of that sort of looking at available document and thinking about the issues. You're asked to identify some strategic issues or critical strategic issues that need to be focused on, and so find a handful of those. And essentially, that is a bit of sort of saying, based upon all the things going on, these are some of those things that we really need to be giving some serious thought to. And so you're starting to winnow that down a little bit. We do recommend, 5 to 7 as a starting point. And if there's more, it's all great. There's a couple of layers of analysis. One is it a strategic issue? Is it more future-oriented, longer range, critical to the ability to achieve its purpose? And so that's a strategic issue versus the operational issues, which we will often be dealing with. Operational, shorter term, more day-to-day, 1 year at the most. Project management, sort of those project management kind of things, those tend to be very operational. Budgeting seems to be very operational. We also distinguish that between crisis issues. So there's lots of issues, going on, and we all deal with our crisis of the day. And frankly, from a strategic planning point of view, if the crisis of the day or other kinds of crisis, whether it's a natural disaster or an infrastructure challenge or a facilities issue, or even the ability in some situations to maintain essential services, when you're in that level of area, or even think of the environmental scan, political, economic, social, technological, legal, all of those could be crisis areas when you think of our tribal communities. So if there's so many of those, that you're just struggling to deal with those, probably not the time for a strategic plan in general terms. So just try to keep that in mind. The next place where we'll come to and where we'll focus on in the next webinar is what are those 3 to 5 to 7 areas, those 3 bundles of things you're going to focus on, that are going to, be the place where you're going to develop those outcome-related goals and those why-based objectives. In some respects, they will, depending which model you use, the balanced scorecard really tries to narrow it down to three strategic themes. Um, I like, other models keep it in the 5 range, sort of manageable range. You start getting past 7, you're really not being strategic. And I'm actually dealing with one community's traditional council who has a responsibility. They have 12 priorities in their strategic plan, and the staff are basically saying, that's too many things. I can't make any progress on any one of them because 12 things is too much to try to manage, between the meetings of that particular council. So again, try to keep it down to a manageable amount. Um, and remember that you're trying to make choices. We're not going to boil down 12 to 5, but keep everything that was in the 12 in the 5. We're going to try to find some priorities and some avenues to drive through that it's going to get us to what we want to achieve, but doesn't have us doing the 500 things that are already listed in the sort of the activities in the what list. So remember that. That's often a challenge for strategic planning. Um, our leadership and our management will develop a host of other things that they want to do, but they won't make a hard, conscious choice about what to take off your table. And so in terms of this particular project, the limited resources you have, some of you have a pretty large territory and number of communities to cover. Um, they've laid out a number of key areas, and we talked about them earlier in terms of those critical strategic areas: prevention, treatment, recovery. Balanced scorecard always says look at organizational capacity, look at internal systems and processes, look at finances, look at community impact. That we often always add governance is a big issue, or the role of our government, depending on whether we have boards or whether it's a tribal council, that has the governing responsibility. So, those are often areas that, uh, which are the focal point of these 3, 5, or 7 core strategic areas. Um, we talked about capacity gaps earlier. Often those will get dealt with sort of in the normal operating of the organization. And relative to your grants, you really do want to focus on what are the capacity needs to achieve this particular grant, so that you're not trying to deal with the organization's bigger needs. But if there are there are some of those gaps that are significant barriers to getting this done, then you do need to sort of figure out how to allocate resources to it. In terms of prioritizing, there's lots of techniques. I just name a few here. Lots of materials on those. T-charts is just, putting a T down a page, so costs on one side, benefits on the other, for example. Force field analysis the way it actually lays out, it kind of looks like they call it the fishbone technique, because you're sort of all these factors which are coming to bear on your decision points. So again, that's another one. Decision-making grids often are like the SWOT analysis, just basic 4 quadrants where you're laying out some dynamics. You can also use criteria. The good example on decision-making grids is you're buying a car. What must you have in the car? What would you like to have in the car? What are some of the limitations that you're dealing with, and all, and then what's the level of importance of any of these things? And so, they're given weights. So that often happens in a decision-making grid. Again, lots of material out there. We're not going to try to go through any of that today. I want to talk about the sort of the simplest, most straightforward ranking procedure that you can use. By the way, the other ones I mentioned earlier, this can be done individually or in groups of any size, so they're useful. This one here is really helpful when you're working with a group. You've got a large list of things you want to make some choices from it. So let's say you do your critical strategic issues and you've got 20 and they're all strategic. You want to boil that down, or you're looking at core strategic areas and you come up with a dozen. You want to try to get down to 5 or 3. This is a good way of sort of showing where your participants, your working group, your project team, may have an area of interest, and it's just simply dot voting, right? So just using dots there at the business supply stores. They're called color coding labels, but and what these next few slides are is essentially that process for doing it, and a few facilitation techniques that'll help you to do it. I would say the basic lesson is you're trying to force some choices. So for those of you who recall when I walked through that cards idea, same thing. What are your 10 ideas? Pick your top 5 because you're not going to be able to do them all. And then everybody, as you went through that process, essentially people were prioritizing all of those ideas through that process. So again, prioritization applies lots of different places. The general rule is give them a third of the choices that they have. So if there's 12 items on the list, they get 4 dots. And by the way, a simple facilitation technique issue is dots come in, they come 4 across and 6 down. So to make it easy on me, I always try to keep the dots to 4 and 6, just as a little thing. And you'll see if you ever get to the dots and see them, if they're laying around the office, you'll see what I mean. If you don't have dots, you can, it's a low tech. You can actually just have people go up and do check marks, and you're doing it on an honor system. And really, nobody's cheating in this process anyway. Voting could be strategic. People are given the choice in the dots exercise to actually put all their dots on one thing if in fact they feel that that's the most important thing. And I have to say, in my 20 years of experience of facilitating and strategic planning, maybe once or twice in all that time in all those groups have I ever seen anybody do that, because people have multiple interests and they want to make sure that their voice is being heard in multiple areas. So sometimes people worry about that. It doesn't necessarily, in a very small group, that could be a factor, but if you got a larger group of people doing it, that's not really going to be much of an effect on the outcome. It might move a priority a little bit, but it wouldn't necessarily be the determining factor. Maybe at the sort of, if you're, let's say, doing the top 5, it might affect that. Another little facilitation trick: when you go to count the dots, use another marker and cross them off. And it's just a thing that helps you to count them quickly. Announce the rank, discuss it, right? So then people will get some learning out of it. And in the end, this final bullet point here: strategic planning, a final decision will get made when the actual strategic plan is adopted. So whether that's things you rank, whether that's core strategies, whether that's goals and objectives, whether that's activities, whether that's the vision, whether that's the core critical strategic issues, whether it's the environmental scan. This is all good stuff, but until who's ever in charge approves the plan within your organization, what you have, it's really still draft. So again, just to be clear about that. When your strategic plan or when your strategic template is completed, who's ever in charge of it. If you're in charge of it and you're signing it off, then that's when it's finished. So you get a little bit of latitude. One of my friends calls it in the splendid isolation of writing. Pam, I'll turn to you in terms of sort of bringing these prioritization back to the FOA and the medically assisted treatment.
Okay. So in terms of priority setting, one of the other, specific to this initiative, one of the other ideas is to look at what were the priorities that you signed up to address. So there's not a lot of mystery here. The priorities were, and it's clear on page 7, and I'm quoting, all grantees are required to prioritize the delivery of MAT services. So no matter what else you do, I would think that would be somewhere in your top priorities. And so just using that, then if that were the goal, then the objectives, what is it that you have to do to make that happen? In just a few examples, do you have to identify existing and available MAT prescribers, or do you have to find prescribers that are willing but maybe aren't properly trained and get them connected to the proper training? If you've got prescribers but they're not culturally competent, then what do you do to get them up to speed in working with your population of focus? What do you need to do to develop your workforce to make sure that the associated therapeutic supports that go with the medication, because they work together, and also the recovery support are accessible and appropriate and evidence-based. And so, you just start sort of making your list, which are, what you have to do to operationalize these, in other words. One of the other goals of this initiative was to prevent overdose-related deaths. And so to do that, what would you need to do? If that were your goal, you would find out, well, who's doing this now? Presumably someone is, someone has naloxone, you might know it as Narcan, but perhaps there's not enough. Maybe it's being done at the hospital, but it would be better to have more accessibility to naloxone overdose reversal medication, closer to home in your tribal communities with families that have opioid users living there, or with the opioid users themselves, or folks that typically interact with opioid users, to have them be able to save someone's life if they're overdosing. Well, what will that take? What are your next steps? So I just refer you back to, in terms of priority setting, among your priorities should at least be these two things: the access to the medication-assisted treatment, and the, what are you doing to prevent overdose? And of course, treatment is one way to do that. So that's all I have there.
Okay. Thanks, Pam. Just a note, Kim Rogers gave me a chuckle. She said, now and then we saw people moving dots. Of those that put dots before them, spotters help to reduce the temptation. I always joke as well, you got blue dots, hide all the blue markers. Elaine Clements mentioned she mentioned that it was really quiet, and I just wanted to double check with Elaine, and I sent her, put a quick note in the chat. Was our audio sound not working for a moment there? I just want to double check on that.
I think she was talking about a form of Adobe Connect where the transcript follows along so that you can see what people are saying, not just hear it.
Yeah.
And I think Kate said our platform at the ATTC doesn't have that capacity.
Yeah, so up above, Elaine had just said it's really quiet. So I'm not sure if that was a volume issue for us or what that was. I just want to try to make sure we clarify that.
Yeah, I don't know.
Okay. All right, we're at 12:32, or here on Pacific time, 3:32 Eastern. So we've come to the conclusion. We do want to make sure people have an opportunity for questions, and we'll keep monitoring the chat room, but perhaps we'll turn it back over to Jeffrey to provide the closing.
Sure, thanks, Harold. I believe I fixed my mic at this point, and I just wanted to remind you to complete the GPRA form that you'll be prompted to submit after this meeting. And I'll encourage you to go to the webpage where you can find resources and look at the next webinars that are coming. The next webinar we'll have will be 1 week from today on Friday. So until then, I hope to see you there. Let's see, it looks like we have some questions coming in.
Yeah, so Elaine's noting voices were very faint there for a while, so we'll have to pay attention to that. Neppy, really that's a question to Kate in terms of how do we get the link for the invite for the next webinar? And then
yeah, we'll troubleshoot that.
Yeah, so Jeff, did you want to respond to
that? We'll troubleshoot that, Elaine. We'll try to make sure we're clear.
Yeah, on the sound issue. Yeah, so guys, if that happens during the webinars, raise your hand, put something quickly, tell us in the chat room so we can do that. So Kate, I see you've listed all the upcoming webinars page. If they go there and they click on on the 16th, if they go to this site, they click on the meeting, they'll get access to it. Is that correct?
Yes, that's right. So, and just to clarify, once you click on the link for the upcoming webinars, that will direct you to a registration, and then you should receive a confirmation email after you've registered. And then Jeff will also send out a reminder the day of the webinar, and so you should get that as well from the TOR listserv. So that link that's on our site listing all the webinars will direct you to registration, and then you'll get the instructions for how to log in.
I also wanted to respond to Lakota's comment there. So if you're using the strategic activities plan template, where will we include our themes and our goals and those kind of things? I would say that that would essentially be a part of your cover to that. The other thing, so a bit of a cover note to that, and then you get to sort of um, the heart of the work plan for this particular piece, because that strategic template is a bit more action plan oriented, because SAMHSA did recognize that in this short period of time, that might be more appropriate than a full strategic plan. The other way is, you are doing a bit of translation of the objectives there. So you could be looking at sort of anchoring it there. And then the chart does lay out, the way I think Pam did the chart was to try to match, in some respects, all the requirements that we're seeing in the FOA. Pam, I don't know if you wanted to add to that question.
Well, yeah, one of the questions was, where will they be able to access an example? I always find when we give an example of a template or a form or something, it always helps to see, an example, just one example of how you would fill it out. And so I can just make up an objectives and some strategies and put that and get that to Kate and Jeff to put on the website. And I'll try to do that as soon as we hang up, and so that it can be there, soon.
Okay. The other thing I would note on that is we have had 2 tribes who've offered to provide their versions that they're doing as a part of this project once they've been approved, and so we're just waiting for that to happen. And once that's available, we get the technical center to put those on the resource page, and we'll also make sure that they're covered in the upcoming webinars. All right, there's just a few last slides here. So essentially what this is just to remind you that the template is there and it's available for use as you need. You're welcome to adapt it again to your needs as it works for you. These were the remaining requirements, and Pam's gone through these a couple of times in some of the webinars. And just as a bit of a reminder to not lose sight of those, and it's because you are trying to essentially in this process, find a place to anchor a lot of these activities. This was the upcoming list, and then Kate had put in the list of these on the website that would give you the direct link. Again, the resources pages, here are hot links as well to some of the same pages we've been putting into the chat room. And here's our final slide. Pam, a final comment, then we'll turn it to Jeff just for the final remark.
Yep, just want to thank everybody for participating, particularly on a Friday afternoon when there might be more fun things to do. So thank you, and I'll turn it back to Jeff.
I took the words right out of my mouth. Thank you for coming. Please feel free to reach out if you have any questions. My email is in the contact and support box, and we will see you next week.
All right, thanks, Jeff. And just as an emphasis, so
bye, everybody.
Yeah, based on Pam's comments as well, we'll try to add stuff sooner if we can get it before the December 16th or November 16th session. But otherwise, goodbye, everybody.